Now we are also joined on the phone line by the NPP Member of Parliament for Achimda and Member of the Health Committee, Honorable Alexander Akwesi Akwa. Thank you very much, Honorable, for your time.
Thank you very much for having me.
Right now, based on COVID-19 cases, that we are recording from the University of Ghana, if you are to compare this to the outbreak under the previous government, do you see any serious concerns here?
Well, good evening to you and your viewers. I'm happy you have started this conversation on the note of comparison. Very frankly, we have been able to put together measures that makes it so easy for this government to handle the COVID-19 so easily. So, as assured by the minister, we are able to contain it. The issue is containable. If you recollect what the minister said, he said this foresight and commitment to preparedness allowed us to detect the current outbreak early and respond swiftly. So what it means is whatever measures that we put in place when this condition broke out some time ago has been very much instrumental in giving us some preparedness for what is ahead of us.
Right now, the minister also touched on the challenges of contact tracing. Now, given that the whole week events, often draw non-students and visitors from outside the university, what emphasis should be given to contact tracing, and how do we ensure that visitors who come in are also being able to trace?
I think that contact tracing was very important during the era where we needed to camp people to be able to give them treatment. I mean, at this point, this condition is containable. It's something that we can all work around it and then solve ourselves. And so it becomes a bit absurd to continue doing contact tracing, because at the end of the period, there are some measures that have been put in place to allow you to seek medical attention at a closer medical facility, and you should be fine because of the structures we put in place. Remember when COVID struck? I mean, it was seen as having no effect on the economy. We are praying that this one should be something that we should easily be able to contain it. Otherwise, it will be so difficult for a system. I said somewhere today that if history has to be kind to Nana Addo Dankwa Akufo-Addo and the NPP government, I mean, it is now, because whatever we have suffered, whatever we have been lambasted for, is now being used very, very favorably to save the situation.
Right now, quickly before we let you go, government has cited financial constraints as a major reason for delays in the completion of Agenda 111. Now, looking back, would you say that it was financially realistic to launch all the projects at once, or now, upon reflections, it was overly ambitious?
His Excellency, the former president, told us during one of his SONA addresses that that was a very ambitious project. And so, but if you look at the way COVID was coming after us, I mean, for every president of a kind of Nana Addo Dankwa Akufo-Addo, it was easier for them, together with Dr. Bawumia, for them to suggest the building of facilities in every district, because this is a condition that shouldn't travel beyond a period. And if we have to get patients to travel up to a distance before they can get treatment, what happens? And so it was prudent at that time to ensure that every district has a hospital. Well, economic conditions did not allow the government to complete it. And we are looking forward for this government to see to its completion. Otherwise, if they have to privatize it and give it to certain private hands to handle it, fair enough.
Now, with information or with what you are privy to, do you foresee this government being able to complete all 111 projects?
No, I don't think this government will be able to complete. I knew that they were going after some investors to help in pushing it together, in putting it together. I have not checked on how that has materialized. And so, but I mean, I'm not sure government can raise resources to finish it up.
Well, we'll follow up on that and see what comes out of it. But another emerging issue is the reappearance of Mpox in some parts of the country. Now, how actively engaged is the Health Committee in tracking and responding to this development?
Well, it was for this reason that last Friday, during deliberations on the business agenda for this week, we insisted that the minister appeared before the House to brief us. And so the Health Committee is yet to take a look at the statistics and the data available. But at the time I was a deputy minister, we had recorded 2 cases and it was a bit containable. I mean, the numbers that the minister talked about is a bit alarming. And so I'm sure the Ghana Health Service will have to put in place all the measures to allow us to, prevent the spread of this condition.
Right now, Honorable, finally, on the ongoing nurses' strike, the nurses say a key meeting to resolve their concerns was unilaterally postponed. Has the committee intervened, and what's the latest update?
The nurses' issue was one of the things that I personally asked that the minister is summoned before Parliament this week. But unfortunately, he didn't address it because the majority leader hinted at that the president needed to have a meeting together with the health minister and the finance minister. What I am told is that the finance ministry is having some difficulty in coming to terms with their demands, even though the health committee stood in for them and assured the nurses that they should give us a period. The day that the meeting was supposed to have been convened for us to convey government stance to them, the 2 ministers were not available. And so we have to tell them that they should hold on. The nurses have given up to a deadline of, I think, July 6th or something. And we are hoping that between now and that period, we should be able to get some substance from government. Otherwise, we, the minority of the health committee, have said that we are not going to be part of this because we think that we had sacrificed our credibility. We led in the various negotiations to get the nurses to be back from their strike, to suspend their strike. And so if government will not be committed to the promises and the kind of pledges they made, we won't be part of it.
Very well. Thank you very much, Honorable Alexander Kwesiakwa, MP for Achim Oja, giving us update on health issues happening in the country. Now